Today, MPs in the House of Commons will debate the ongoing trend of excess deaths in the wake of the COVID pandemic. This comes as the government has been urged to release data that may link COVID vaccines to some of those excess deaths. Well, joining me now is Jamie Jenkins, former head of health analysis at the Office for National Statistics. Good morning to you, Jamie.
Good morning, Julia.
Thank you very much. Now, this isn't the first time we've had debates about excess deaths, but it is extraordinary, isn't it, how little debate and concern there appears to be, not just by MPs, by the government, by the NHS, about, few hundred people every week dying, more than we would normally expect to die, because, my goodness me, we were very concerned about every 90-year-old dying in 2020 with COVID, but apparently we're just not that bothered about loads of people dying, many of them, by the way, far younger than those who were dying from COVID. Why do you think that is?
Yeah, I think, Julia, part of the issue that we've had over the last kind of 4 years now, pretty much, where we've been seeing kind of excess deaths when you compare the kind of deaths going on at the moment with what we saw pre-pandemic. Part of the debate there, I think the challenge is that people don't want to admit what some of the things might have caused them. For example, we saw through the pandemic, didn't we, quite a lot of stay home, protect the NHS, save lives. And then you only got to look at information around, the number of people who attended hospital during the pandemic. You've only then got to look at people getting kind of cancer treatment and the delays in diagnosis there. That no government will probably want to admit that maybe some of the actions that they took during the pandemic have contributed to excess deaths. But I think it's right to have, a live debate in terms of what's driving these things. We've discussed in the past, Julia, that a big factor in kind of when you compare the number of deaths now to, say, the pre-pandemic level at the moment, a big factor in that is that we are seeing a large number more people in the population now over the age of 70 than what we saw, can I say, 10 years ago because of the post-war baby boomers. But if you adjust for that, you still see kind of excesses in 2023 among those kind of middle-aged groups. Thankfully, the excesses in 2024 have started coming back down, and the actual deaths overall, Julia, are below what you would expect for the kind of in 2024. But we still have unanswered questions, I think, through part of the pandemic.
Absolutely. And again, no one should be afraid of asking those questions and getting those answers, because that should surely feed into important information about what we do with the next pandemic. When people say, move on, stop going on about it, I think, no, they're still talking about, well, if we even when we lock down again with the next pandemic, we need to establish what works and what doesn't work in terms of any government or personal actions that are taken, and whether or not the knock-on effects, the cost-benefit analysis proves that they're actually worth doing. And largely, I think we can safely say pretty much everything the government did had a higher cost than a benefit when it comes to people's lives and the economy as well. But in terms of what people are actually dying from, we had a report from the Royal College of Medicine recently saying 250 people dying a week who are arriving in A&E. They're actually in hospital, but they're not getting treated soon enough. So there are people just not getting treated soon enough, people who can't get a GP appointment. And then you've also got people who just weren't treated in 2020 and 2021, and the overspill from that. I've had friends, they didn't get a mammogram, but then they found out they had cancer, and it's at a later stage because it was found much later. We're going to see the repercussions of this for years, aren't we?
Yeah, and I think the problem we had is we haven't got one of the best healthcare systems in the world. The NHS was struggling every winter. You saw, the media headlines around the NHS is going to struggle this winter. We went into that pandemic, obviously, Julia, with the same kind of resources that we had before. And we've got this baby boomer population putting more kind of pressure on the NHS. So it's in an absolute mess, the NHS. We've discussed this many, many times. But this is, I think the point you just raised there is the critical question that seems to be missing for me in the COVID inquiry. Because when you look at the COVID inquiry itself, what they're kind of talking about, all these WhatsApp message discussions, lots of talk around that. But ultimately, all the COVID inquiry needs to look at is what decisions were made, were there any positive or negative consequences from certain decisions.
And no one should be afraid of that. Can I ask you, just finally, just got a minute left, but can I ask you about a cross-party group of MPs who they've written to the Health Secretary, Victoria Atkins, about the government withholding data which could show if there is or is not a link between the COVID vaccine and excess deaths. They're saying they're being met with a wall of silence. Look, if the vaccine has no relation to this, then why are they afraid of releasing the data? Do we have a right to see this data?
Yeah, I think this is in criticism of things coming from the ONS. A letter's been sent from the head of the ONS on this. I think personally, just get in there, do the analysis. They're saying that they don't think there's a public need for some of the analysis, and they've got to weigh up the cost of doing some analysis. But you're right, if there's no issue with what kind of the vaccinations or COVID or any other kind of cause of death, just get the analysis done, put people to kind of at ease, and then let's get on with it.
Yeah, absolutely. Again, with all these situations, if there's nothing to worry about, then there's nothing to hide, and you can release that information. Thank you very, very much indeed for joining us. That is Jamie Jenkins, their former head of health analysis at the Office for National Statistics himself. It will be interesting to watch that debate today.